So if you talk about the HIV, okay, human immunodeficiency virus. Okay, HIV is what? Human immunodeficiency virus. It is also a very dangerous virus in itself. So let me introduce HIV to you. HIV is actually it is also an enveloped structure. It is also an enveloped virus, rather I will say. This is also the positive sense single-stranded RNA virus. Okay, RNA virus. Fine. Second thing which you need to remember about this one, this is the category of retrovirus. This is the category of retrovirus. Retro means, remember, retro means just opposite. Reverse. Retro means what? Retro means reverse. Okay. Retro means reverse. Fine. Now look, what else you should remember about HIV? HIV is having further, if you talk about the structure of the HIV, that should be clear in your mind. Okay, so let's talk about the structure of HIV, how it looks. Okay, let's say this is the envelope of this virus. Okay, I told you this is enveloped or non-enveloped. This is having the envelope, so this is the enveloped virus. Then look at the structure further. Okay, so this is one glycoprotein which I am writing it GP120. GP120 means GP means glycoprotein. Okay, so it is GP120, and this one over here, this is the GP41. This is GP41. So this one is GP120, that region, and this one is GP41. Okay, so look over here very carefully. We are having three kinds of genes. Okay, if you are talking about HIV virus, we are talking about three kinds of genes. And which genes I'm going to talk about? First one is the ENV. First one is ENV gene. Second one, we are talking about the GAG gene. Okay, is it visible? Okay, and third one is POL. That is the pole gene. Okay. Now let me introduce some of the thing over here. ENV gene is having two components. That is, the one is the glycoprotein. First of all, we are having the glycoprotein 160. GP160. GP160 will further cleave down. Okay, GP160 will further cleave down itself into two parts, and that is the GP120 and GP41. GP120 and GP41. Okay, which I wrote over here. Okay, so what I said, ENV gene is having GP160, which will be cleaved down itself into GP120 and GP41. So this is GP120, this is GP41. This is the envelope of the virus. Okay, this is the envelope. Fine, till now everything is clear. Now what will be happening? Look, besides that, we are having more structures. For an example, is the red one structure is this one, and one structure is this one. Okay, what are these? These are actually the proteins as well. So what is the name of this one? So this one is called as CXCCR4. What is that? What is the function? I will be talking about that later on. Okay, this is CXCS4, and this is what? CCR5. CCR5. Okay, so GP120, GP41, CXCR4, CCR5. Okay. Fine. Okay, this is the structure of HIV. This structure will be actually repeatable in different form of fashion, in different fashions, right? Okay. Now, inside it, what should be having? Single-stranded RNA virus. So this will be the single-stranded. This will be what? Single-stranded RNA virus. Further, it will be having inside it. We will be having protease. We will be having integrase. I'm not talking about that thing. I'll be showing you the image of the structure of virus further. Okay, in the MCQ section, right? So the single-stranded RNA virus. Okay. Now, so I was talking about this thing. ENV gene is carrying GP160. GP160 will cleave down to GP120, GP41. Then this GAG gene is having further two components. One is the P24 and one is the P17. Okay, P24 is the core protein. P24 is the core protein and P17 is the matrix protein. P17 is matrix protein. Okay, so ENV gene GP160, GP120, 41, GAG gene P24 which is the core protein, P17 which is the matrix protein. Okay. Fine. Now look at this one, pole gene. About this one I'm writing over here. Okay. So about the pole gene, I told you they come in the category of retrovirus. Retro means reverse. So they are having an enzyme which is called as reverse transcriptase. Which is called as reverse transcriptase. Okay. In the biology textbook, we have all from that we already know that what is the function of, you must have heard about central dogma in the biology textbook from the class 12th or 11th, and in which we came to know that central dogma is a DNA to DNA, it is a replication. DNA to RNA, it was transcription. RNA to protein, it was translation. RNA to DNA, it was reverse transcription, which was happening with the help of which enzyme? Reverse transcriptase. You are very well aware about this concept, right? Now further look, this by the help of this reverse transcriptase, this RNA will be converting itself into DNA. How will it be happening? I will be talking about that thing in few moments. Okay, but for now let me tell you one thing, that this, you understood the structure of this virus. This virus, whenever it will be coming into the body of the patient, okay, how it may come into the body of the patient, what is the route of transmission of this virus? So let me talk about that thing as well. So route of transmission, IV drug abuse. IV drug abuse means drug addicts, I want to say. What is that? Drug addicts, they will be having the higher chances. Okay, because they will be pricking themselves again and again with the same needle. Okay, so they are having the high chances, they are having high probability of causing that virus, right? Then unprotected intercourse. Okay, that is also the cause of the this virus, right? Then blood transfusion. Okay, so I can write it over here, blood transfusion, right? And what is the case? This is the vertical transmission. Vertical transmission, what does it mean? Mother was having the virus, she transmitted it to the fetus. That is the vertical transmission, very high chances. If the mother is HIV positive, okay, she is actually advised to not have a child. Okay, fine. Okay, let me tell you one interesting case which happened in India. There was a case, actually what happened is, there was a guy and he had unprotected sex. After that, what happened is, he got the HIV. Okay, he was having unprotected sex with the commercial sex workers, and that person actually got the virus now. And after a week, this patient actually went to a this one blood bank, and he donated his blood. Okay, and when he donated the blood, actually at that time what happened is one of the unprofessional men, he took the blood and actually he deposited that blood into the blood bank. Then what happened is a doctor from any kind of hospital, they need the blood transfusion into a lady, for a lady, and they ordered the blood from there, and actually that the same blood actually went to the hospital. And obviously doctor actually believes the blood banks, so they didn't cross check the blood, and they just went for the blood transfusion into that lady. And after 2 to 3 days, the that lady was found to be HIV positive, and actually she passed away after that, and they cancelled the license of the doctor. So the doctor was not the culprit over here. The culprit was that man actually who didn't check the blood. Okay, so that was the case. So that interesting story happened in India. So these are the causes for the route of transmission of HIV, right? Okay, so now what will be happening further? Now let me talk about the pathogenesis of this virus. Okay, shall we move on to the pathogenesis? Fine. By the way, one more thing. You are a clinician, you are a doctor in the hospital, you are working in your cities, and the patient will be coming. Okay, you never know which kind of patient comes to the clinic, which kind of patient will be running into your department, and you are a doctor on duty. You are having a case of HIV, and while having the these kind of things here, if you have to inject something, if you have to inject some medicine and all these things, you should be very, very careful. Okay, so you should be wearing the double gloves actually while doing any kind of procedure to the patient of HIV or hepatitis. Okay, for an example, the case of hepatitis B is there. Okay, so many times it happens that doctors and nurses, they actually prick themselves with the same needle which they were injecting, in order to recapping that needle. Okay, so do not recap the needle. We are having the tendency to recap the needle. Okay, the needles are having cap. Okay, so do not recap the needle if you are using it on any kind of patient. Okay, directly dispose it. Okay, so many of the cases happen that during the recapping, and what is the size of the needle, it can actually prick very easily. You will not be knowing actually that, right? And if there is a case of prick, as far as HIV patients are concerned, there are chances that 3% of the chance are there that you might get infected with HIV. 3% chances. However, it is less, but it is there. Hepatitis B are having the 30% chances. If you get prick yourself accidentally, they're having the 30% chances, and you should be doing something within 72 hours. Okay, so that is the case. Okay, fine. Pathogenesis is the favorite place of HIV virus. The favorite place of HIV is inside your body, that is the T helpers. That is what? T helpers. Okay, T helpers are actually the CD4 plus cells. CD4 T cells, right? So look over here, T helper, CD4 T cell. What will be happening? This virus will be coming to the body, coming inside the body through these route of transmission. Okay, entering inside the body. This virus will be affecting which cell? Immune system, CD4 T cells. Then what will be happening? I am talking it about here. Okay, let's say here. Shall I rub this one? Okay, look, this is the host cell. This is what? Host. Host means like human. Okay, this is the host cell, this is the virus. It will be coming over here. Okay, GP120 is for the attachment. GP120 is for attachment of this virus with the host cell. Okay, attachment. GP120 is responsible for the attachment of the virus to the host cell. GP41 is responsible for the fusion and entry. Understanding? Fusion and entry of this virus into the host cell. So it will be happening like this. For an example, this is the host cell, and this is the host cell, and this is what? HIV virus. Okay, it is having the GP120. GP120 will be helping this virus to attach with the host cell. Okay, to attach with host cell. Now what will be happening? There will be the GP41. GP41 will be happening to enter and fuse inside this cell. Okay, so GP120 will be binding to this cell, and GP41, with the help of GP41, it will be entering inside the cell. Okay, and once this binding and fusion will be happening, CXCR4 and CCR5, okay, which are also present on this surface, CXCR4 and CCR5, okay, mainly they are present on the cell surface. What they will be doing? Binding to this HIV virus, okay, and they will be actually initiating what? This fusion and entry of the HIV virus. And further, what will be happening? This single stranded RNA virus, it will be moving inside the host cell. It will be moving inside the host cell. In the host cell, we are having the nucleus inside the cells, right? So let's say here is the nucleus. Inside the nucleus, we are having double-stranded DNA virus or virus. No, we are not having virus. We are having double-stranded DNA or single-stranded? Double-stranded, right? So we are having double-stranded DNA, right? So this is the double strand, right? This is the double strand. So let's say here is the nucleus of this cell. This is the nucleus, right? This is what? Nucleus of this cell, okay? Nucleus of this cell, and here was the virus. What will be happening? Look. This virus will convert itself. This virus will convert itself into double-stranded DNA with the help of what? Reverse transcriptase enzyme, which was the help of pol gene. Understood? With the help of pol gene. So this virus will now penetrate the nucleus and it will be binding itself in between that. For an example, like this. Okay. Understanding? So this thing will be happening. So what happened is this virus, okay, it will be actually transcribing itself into the DNA, and this DNA will be glued into this DNA of the host cell. Okay, and now what will be happening? Replication. Now what will be happening? Replication of this virus. So now more and more HIV copies will be produced by our own body. Okay, and a lot of copies will be appeared in the blood circulation, and then they will be actually acting on another host cell. Same machinery will be happening, and then replication will be going on, right? Okay, we all know that HIV causes the AIDS, right? Have you heard about that? Human immunodeficiency virus is responsible for causing the AIDS, but in what conditions? That is the main thing. HIV virus. So let me tell you about the diagnostic case. Okay, and then I will be telling you about this thing. So for the diagnosis purpose, what you should write? Everybody understood about the pathogenesis? Okay, everybody understood? Shall I repeat? Understood? Okay, so for the diagnostic, what you should do? You should check the CD4 count. What you should check? CD4 count. If the CD4 count is between 200 to 500, okay, 200 to 500, actually it should be more than 500 if the person is not having the HIV. If it is less than 500, that means the person is HIV positive. Okay, if the less than 500, which means the person is HIV positive, right? So if the person is having CD4 count between 200 to 500, many of the opportunistic pathogens are there which can enter into the body. Opportunistic means they will be finding the opportunity to penetrate and to go into the human body. For an example, which kind of opportunistic pathogens can be there? For example, pneumocystic pneumonia. Okay, for an example, Candida. Candida is a yeast, Candida albicans, and this can cause what? Candidiasis. Okay, oral thrush in the mouth. Okay, that is the white color of thing, right? Okay, further candidal vulvovaginitis can be seen, cottage cheese discharge or the cardioid discharge from the vagina, right? Then further it can also cause the candidal esophagitis, which means in the esophagus there is the white patches. Okay, so they are the actually subtypes of the candida. Further, oral hairy leukoplakia. Oral hairy leukoplakia can be seen in the patient. Okay, so that is when the CD4 count is between what, 200 to 500. If it is getting less than 500, if it is getting CD4 count is less than 200, less than 200, then this person may have the acquired immunodeficiency syndrome. That is what? AIDS. Okay, that is what? AIDS. So AIDS is, you can say this is the severe situation, okay, where the CD4 counts are less than 200 actually. Okay, so that is the case over here. What will be the clinical presentation of the HIV patient? That is very important. That's how you will be able to determine and diagnose the condition of HIV patient. Okay, so what will be the clinical presentation? Yeah, immunity will be decreased in this patient. So let me talk about the presentation part. Shall I rub this one? Yes. Okay, so let me talk about the pathogenesis of this virus. Presentation part. How this patient will be presenting to you. Okay, so there will be immunity will be decreased. Obviously, there will be the multiple lymph nodes will be enlarged. For an example, this cervical lymph node will be enlarged, submandibular lymph node may be enlarged, right? Then axillary lymph node may be enlarged, inguinal lymph nodes may be enlarged, right? So several lymph nodes will be enlarged. So we are calling them as polylymphadenopathy. What we are calling that as? Poly means many, lymphadenopathy. Understood? Further, in the patient, there can be the presence of fever, there can be headache, there can be myalgias. Myalgias means that is muscle pain in the muscles, right? That can be the features of this one. Further, if the patient is having some of the patient may have the problem with the immunity, so immunity is dropping. Okay, so many of the opportunistic pathogens can be found over there, and then further they can actually show their symptoms as well. Okay, so symptoms list is quite big as well as far as HIV patient is concerned. Okay, so these are some of the presentation part of this HIV virus. Okay, so how can you diagnose? On the basis of CD4. Yeah, you will be checking the CD4 count, as well as you must remember one more thing. You are also checking the DNA RNA of this HIV patient. Okay, and you are also checking the antibodies. Okay, now the treatment part. Okay, in the treatment part we are using the HAART regimen. HAART regimen means HAART. It's not HEART, it's HAART. So let me talk about the treatment as well. So in the treatment we are talking about the HAART regimen. Okay, what is HAART? HAART means highly active anti-retroviral drug. Okay, highly active anti retroviral drug. We know that it was retrovirus, right? So we need to work against this retrovirus. So that will be the antiretrovirus. Okay, antiretroviral drug. So HAART therapy will be using, HAART regimen will be using in this particular case. Right? Further, the patient will be having the symptomatic treatment, obviously. Okay, symptomatic treatment means whatever will be the associated condition, we need to treat that particular symptom. Okay, so highly active antiretroviral drug and the symptomatic treatment. Okay. Okay, so that is about the treatment part. So what you know about the HIV human immunodeficiency virus? It is the enveloped positive sense single stranded RNA virus, right? Then further, I told you about the pathogenesis. Pathogenesis is that is condition is having like it is having the GP120 and the GP41. So with the help of GP120, it will be actually attaching to the host cell membrane, and GP with the help of GP41, it will be actually fusion and entry of the HIV will be happening in this one. So once the RNA virus will be entering into the host cell, this was the host cell, right? So it will be transcribing itself with the help of RNA. Means like reverse transcriptase, and it will be converting itself into DNA, and it will be gluing itself into the region of this DNA, which was rDNA, right? And then it will be replicating and making more and more copies, and those more and more copies will be affecting more CD4 plus T cells, right? T helper cells, right? I told you about the presentation part. Polylymphadenopathy will be seen, okay? And then the person will be having myalgias, pain, headache, fever, and the mononucleosis like symptoms can be appearing. Infectious mononucleosis, okay? The same symptoms which we seen in the Epstein-Barr virus, that is the EBV, which is the kissing disease. Epstein-Barr virus also infectious mononucleosis kind of symptoms can be seen in the patient, right? Okay, then I told you about the diagnosis part. We'll be checking about the CD4 count, and according to that we'll be checking which kind of other associated conditions can be present in the patient. Okay, so HIV is giving you the many kind of other problems. Okay, it depends on the CD4 count, it depends on the status of the immunity. If the immunity is more weaker, more amount of problems will be coming. The immunity is much stronger, then obviously these kind of condition can be prevented, right? What about the treatment part? I told you about the HAART therapy and the symptomatic treatment. Highly active antiretroviral therapy we will be using in the patient, right?